Turning now to the pandemic and yet another disturbing milestone. More than 2 years in, the U.S. is poised to surpass 1 million COVID-19 related deaths this week. And there have been nearly 82 million confirmed cases of the virus in this country. So we want to bring in Dr. Anthony Fauci to talk more about where we stand right now in this pandemic. He's the director of the National Institute of Allergy and Infectious Diseases, as well as the chief medical advisor to President Biden. I feel like we don't need to say that anymore. People know who you are, Dr. Fauci. But thanks for joining us. So here we are inching towards this, grim milestone that had been initially presented as kind of like the worst case scenario, 1 million deaths. And I just keep thinking to myself, with so many people vaccinated, who is dying in the sort of later stages of this pandemic? Why do we still see, even though the death toll is down significantly, why are we still seeing people dying?
Well, there are two groups of people that are really accounting for the severe disease, hospitalization, and death. One group certainly is the unvaccinated, because unfortunately in this country, we have a substantial number of people who have not been vaccinated at all. We only have about 67% of the entire population is fully vaccinated. And those who are vaccinated, only about half of those have received a booster. So unvaccinated are accounting for some of the severe disease and death. But you're absolutely correct. There are vaccinated people who get infected, some of whom go on to severe disease and death. Those are very heavily weighted towards the elderly and those with underlying conditions, those whose immune system is compromised for one reason or other, either through underlying disease or medications that they're on. So as long as you have vulnerable people in the population, even though the unvaccinated are going to be much more at risk, even vaccinated with underlying conditions and a high degree of susceptibility to severe disease will account for those deaths that we're still seeing. And you're absolutely correct. The deaths are substantially lower now than they were 6-8 months ago. But nonetheless, right now, we're starting to see an uptick in infections. We went way up and then we came very far down, and now we're starting to see an inching up of infections, and even in some regions of the country, even hospitalizations.
And Dr. Fauci, you've talked about how the U.S. is entering a transitional phase of the pandemic. Explain to our viewers what you mean by that, and what is your prediction for when we might possibly enter the endemic phase with this virus, if at all?
Well, I have to start my comments off by saying we don't know, because nothing is really certain. And this virus has fooled us multiple times in the past with the emergence of the Delta variant and then again the Omicron variant. So to be perfectly honest, we don't know. But if you want to make a projection, when you talk about transition, I was referring to several months ago. Remember, we were having 900,000 cases a day, tens of thousands of hospitalizations, and over 3,000 deaths per day. That number has come dramatically down. Even though we're seeing an uptick now, what we're hoping for is that when the level comes down, it stays in a well-controlled level. And those people who've been vaccinated and boosted, even though they might get infected, they won't get a severe disease that would lead to hospitalization and tragically, in many cases, to deaths of individuals. So hopefully the combination of vaccination and booster and people who've been infected and recovered, and hopefully many of them have also gotten vaccinated, that the level of immunity throughout the community will be high enough that even though you'll see an uptick of infections, we won't see a comparable increase in severity manifested by hospitalization and death. If you want to call that endemicity, some people call it endemicity, some people call it living with the virus, but it really has to be at a low enough level that it doesn't disrupt society the way it has done so dramatically over the past 2.5 years.
Dr. Fauci, I think what is sort of challenging for a lot of us now is to figure out exactly how do we live in this phase, right? When do we wear a mask? When do we not wear a mask? If we're gathering with family members, should we all get rapid tests or not? I take public transit transportation now. And, about, I'm going to say 40% of the people still wear masks. Most people don't. Sometimes I wear the mask, but I feel really self-conscious when no one else is wearing a mask. Can you just give us, and I know there are no hard and fast rules because it all depends on, what the infection rate is like wherever you live, but are there just some precautions that you would like to see stay in place for the time being?
Yeah, so you said it quite correctly. It really is going to, first of all, there are no hard and fast rules except for the fundamental underlying recommendations that the CDC makes, and they try to guide us by giving us a sort of a map of the country with all the degree of infections, hospitalizations, and hospital capacity, which really makes for the color coding that you see, whether or not it's green or it's yellow or it's orange, and then hopefully never red, but it can get to that. So the situation is as follows. I mean, there's a lot of degree of variability, including what the level of transmission of infection is in the region or the place and the location you happen to be. But it also gets to something that we've been talking about for some time now. It's each person, with help from guidelines from the CDC, to make a determination of the level of risk that they're willing to take. So if you go to an event in which it's required that you have vaccination proof, it's required that people show a rapid test within 24 hours of so, that makes the risk very, very low. It isn't zero, but it's very, very low. So under those circumstances, if you're a healthy person and you don't have someone at home who's at risk, so that if you get infected and you bring it home, there wouldn't be a big problem, you could feel reasonably comfortable without wearing a mask. However, if you happen to be someone who is an elderly person, who has an underlying condition, who has a vulnerable person in their own household, so that if they came back, even though they were not symptomatic themselves and they were infected, they could then bring it to someone who could have a serious outcome. That's a risk that someone would say, even though it's not required to wear a mask under the circumstance, I might want to go the extra step to wear a mask, not only to protect myself, but to protect those around me in case I get infected. There's a lot of that now that we're going to learn to adjust to, and that is a determination of your own individual risk and the willingness that you're willing to take that risk.
It's a good point, Dr. Fauci, as always, and certainly the empathy displayed by wearing a mask when you know you're going to be around people who might be compromised is one that we should all think about doing. Dr. Anthony Fauci, always great to have you, sir. Thank you.
Good to be with you. Thank you for having me.